Eti tunaishi dunia hii mara moja wanavyosema. Sasa watu waponde raha, wafanye wanavyotaka. Nini itakufaidi kupata vitu vyote vya dunia na kisha ukose ufalme wa mbinguni?
I know that many of you have been to the hospital, and I thank you for that. First of all, I would like to introduce myself. For those who do not know me, I am Dr. Mariarita Solis. Okay, I am Dr. Mariarita Solis. I am a gynecologist, and I only examine women alone. Okay, I have been in Kenya since 2004. For those whom I have done surgery at Kendo Adventist Hospital, there are several of you here. And from there, I stayed for 10 years. Then we transferred to Nairobi for Better Living Hospital in order to establish a new hospital down there. And after that, we came back to Kendo and then transferred to Nyanchwa. So we have been in Nyanchwa since 2014. I am an old woman. I am 66 years old. Yeah, I have 4 children. Jackie is coming now. Jackie is going to interpret. Is there a need for interpretation?
No.
No? Okay. Served Cameroon for 6 years. We were under the Seventh-day Adventist Church since that time. So we came from the Philippines, and we left the Philippines in 1999. And all those years have been in Africa. So now we have retired actually, because I am 66 this time. My husband is 68. So we have retired effective January 1, 2023, and we went home. But now Nyanchwa called us again to come back, because I think that it's not really possible for the hospital to stay like that, to function as it is without doctors. It's very difficult to really get doctors to come and work in the Adventist Church. It's very difficult because, first of all, money is very little. As we are funded by the Seventh-day Adventist Church in the United States, we do not receive anything from Kenya. So for all these years, it's like that. So please, if you have children, let them go to medical school and then come back and serve the Adventist hospitals, okay? Because that is the only way that you can really improve the health care in our country now. Because we are not going to stay for long. We really have to go home because age is catching us up also. Okay, so today I would like to inform you that on date 1 to 31 October is a breast cancer awareness month. Okay, so for all these days from this time up to that 31st of October, we shall be always telling people about breast cancer awareness. Okay, yeah. So we are planning at the hospital that we will hold a special free clinic for screening for breast cancer. We will give you that information later. Anyway, Josaphat is with you, so he will know when that one will be. Okay? To just dry run 2 cancers. Cancer of the breast and cancer of the cervix. Do you want that? First of all, I think I will have to, who are 40 and above here? 40 and above. Yes, okay, majority are 40 and above. I would like to inform you that at 40, we start to experience the menopause. Okay? There are 3 phases of menopause. The perimenopausal period, which runs from usually age 40 up to 48. Then the menopause proper. Menopause proper is that you will not receive your period for 1 year or more. Okay? Then after that period, you go into the post-menopausal period. These are the 3 phases of our menopause. And especially for those who are always coming for regular checkup, if you can remember, we always give you the calcium. Or if we do not give you the calcium, we tell you to exercise. Because exercise and calcium, they are almost having the same. Okay, these 3 phases of menopause, we give you calcium or we ask you to exercise. Because these 2 things are the only ways that you will improve the quality of your bones. You know, in menopause, one of the signs and symptoms of menopause is depletion, lowering down of the calcium level in the body. And as we know that calcium is the one that supports the teeth and the bones of the body. If it is low, if the level is low, then you will have pains all over. From here, 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 Ogembo here, this one hips, this one here, and the ankle joints. Okay? So one way of improving the quality of your bones is to exercise regularly. We do not ask you to exercise for a long time. It's only 30 minutes a day. 30 minutes only. You exercise for 30 minutes regular, except maybe Saturday because we have church. Exercise can improve the quality of your bones because it always changes the cells in the bones. So we really need to exercise. There is a funny story about exercise for women here. When I was at Kendo, I was teaching women about this exercise. Then I told them, okay, now we have to make a group. At 4 o'clock, we have to come out of our house and we start jogging. One woman said, "Ay, Daktari, you know, if we start running that one at that time, Daktari, people will tell us that we are night runners." So we cannot, Daktari. So, okay. So I tell them that, what if you will just run, what is this, in your concession, in your compound? Yeah, you just run. But there are 2 types, okay? If you cannot really jog, the best is jogging, 30 minutes. But if you cannot jog, you just do the brisk walking. Walking, but not the walking that is the normal walking that we have, but the faster walking. Okay? We call it brisk walking. 30 minutes a day can give you a lot of benefits in your bones. The reason why most of us here, especially in Kisi, we always complain. All patients who come to me will always say, "Doctor, you know, what is your problem today?" Then they say, "Why?" I said, "Why? Where have you been? Have you been in the Shamba or maybe like this? You know, here, you bend always. You always bend. You overwork your back. When you clean your back, you bend. When you wash your clothes, you bend. Everything is bending. Okay? So at least you will also give relief to your bones. Give relief to your bones." I was teaching them that, for example, if you wash your clothes, you sit on a chair, put your basin on a chair, and then you start washing like this. Then they all laugh at me. Because, but we have to change, okay? I know that it is your culture, but I think that you can also slowly, gradually, change for the better. Because you will really overwork your back with that one. And you will always complain of pains on the back. And I can really tell from the faces of my patients who come that it's really painful. So when we do X-ray, there's nothing. Okay? So, two things. Exercise, or if you cannot exercise, then we will be forced to give you calcium. You know, calcium is a big tablet, which is difficult to swallow. I don't eat my calcium, take my calcium, I exercise a lot. My situation, okay, you might ask me, "Daktari, so why are you, what is this, why at this time, at this age of mine, 66 years old, I can still go to the theater from 8 o'clock up to midnight, standing alone, like 8 or 10 surgeries in a day." For those of you who have been done surgery, that is the number of surgeries I do in a day. So, what is the secret? Do you know that Ekerore Hills? I can run from Nyanchwa to Ekerore Hills, come down, go back again, come down 3 times. So, let us do that, okay? It doesn't harm. It doesn't harm. When you start your exercise, the first 3 weeks, you will have sore bodies, very sore. You continue. If it's still very painful for you, then you can take like Panadol or whatever, painkillers, yeah? But after 3 weeks, sore, that pain will disappear. Then you will get used to that exercise. It's really beneficial, especially for those who are in menopause, beneficial exercise. So please remember that, okay? That we need to exercise a lot. 30 minutes a day only, okay? Now let's go to breast cancer. I just have to wrap up. I know that everybody knows what breast cancer is and who are those who died of breast cancer. Hindi? Yes. So, this breast cancer, there are 5 things that I would like you to remember. First, that this breast cancer, although it is the #1 cause of death among women, there are still things, in spite of your knowledge about breast cancer, there are still 5 things that you need to remember, which are just uncommon, but they are still important in our knowledge about cancer of the breast, okay? I just want to go into the details of what kind of cells are this, do you want that? Because like squamous, like what like that, I don't want to do that, but I just want to let you know that, #1, breast cancer does not necessarily start with a lump or a mass in the breast, okay? It does not necessarily start with that one. Most of us, most of the patients, not only us, will wait until we feel like there's a lump here. Then let me go to the doctor, okay? Not only the lump. Of course, lump is also one, but not only lump. Redness, for example, redness around the breast becomes red. Second, what is this? It becomes thickened. The skin here becomes thickened. Okay? Then it's hot. When you touch it, it's hot. Unlike the other one, maybe. So you wonder why? What is this problem? Later on, there will be discharge from the nipple. Discharge from the nipple, whether it is watery, whether it is yellowish, whether it is pus, they are all abnormal. Because normally, whether it is milk when you are not pregnant, okay? So, that one is still abnormal. So, you really have to go to the doctor. Or, pain of the breast, which lasts long, 2 to 3 weeks of pain, continuous pain. Okay? So, those are the things that will really make you to go to the doctor. Immediately, when you see this kind of thing, redness, all those things that I have mentioned, go right away to your doctor, tell your doctor about the change. Okay? #2, you don't need to know how to do self-breast examination. We always, I don't know, many of you have known SBE, self-breast examination. Okay? We are told that it is not necessary that you can know how to do self-breast examination. But the most important thing is that you have to know how your breast look and how your breast feel. Okay? So that by the time you will go into the mirror, for example, after taking a bath, go to the mirror, and you find that there are changes. My breast is no longer the same as before, yeah? So immediately go to and report it to the doctor. Okay? Do not wait until it becomes the contour is now different that you will go. No. Next, you know this like orange peel appearance. Orange peel, you know this orange, they are just like not really pimples, but just like holes, yeah? If you see that one in the breast, please don't wait for that actually, because that one is a sign of cancer. Yeah, so go right away to the doctor. Don't wait until it goes to the armpit and now becomes like very, what do you call that? Very shiny skin now with that one. And then there's like orange peel. You know this orange, huh? You understand what I mean? Yes, orange. We call it orange peel appearance. Don't wait for the time to come, then you go to the doctor. Another thing, our armpit has nothing in it, okay? Our armpit has nothing in it. If you find that there is a mass in the armpit, go right away to the doctor. Okay? If you find a mass here, we call it collarbone, yeah? Here, for example, if you have a mass here, regardless of the size, go right away to the doctor. Okay? These are signs and symptoms of cancer. Next is, I hope that it is not among us here, that drinking several glasses of alcohol every day will increase your risk for cancer of the cervix, or cancer of the breast. So I know that it is not among us, yeah, but I'm just including it so that you will also know. So those are the important signs and symptoms of cancer, breast cancer. How, you might ask, Daktari, how are we going to prevent this kind of happening? As I've told you, you have to look at the mirror always. All of us will look at our mirror, yeah? Mirrors. Then be sure that you know how your breast look like and how it feels, so that by the time you spot the change, then you go right away to the doctor. Don't wait until it goes to the other stage, okay? So that is one way of preventing cancer of the breast. Okay, of course, 40 years old and above, you are supposed to go for mammogram every 5 years. One mammogram every 5 years, starting at 40 years old. Okay? When you are 40 and above, you are supposed to go for regular mammogram. Do you know what mammogram is? Okay. Mammogram is a special kind of X-ray. It's only for the breast. It diagnoses even the minutest, even the smallest mass that is in your breast. Okay? So that one is not every year, but that one is once every 5 years. Okay? The regular checkup of that mammogram is once every 5 years. Okay? Do you still want to know more about breast cancer? Okay, before we go to cancer of the cervix, may I know if you have some questions? Let us entertain 3 questions only because we don't have enough time. Contour, okay? Then you go to the doctor and the doctor examines you and then, okay, now we have something here. We will do this, we will do this. You find, and the doctor finds that you have cancer of the breast, for example, and it is early. So the doctor will say that, okay, we will do this. And if it is already cancer, then we will remove your breast. That will save you from the advanced stage of cancer. You know, do not wait until you go to the advanced case of cancer that the doctor will refer you for chemotherapy or radiotherapy because the side effects are really hurting. Like you will always vomit and your hair will all fall and then you become very, very black and very thin. So don't wait for that one. The earlier the diagnosis are made, then the better for you and it saves your life. Okay? At the same time. Yeah, I don't know if you have heard of a patient who has breast cancer for both cancers. Usually it is only one.
There is one who has one.
Then later on this one.
But then the doctor.
Okay, but as I've said, the earlier diagnosis is made, the better for you and the life is saved. Okay? We may be sorry or we may be sad that we don't have, breast anymore, when the doctor says that it has to be removed. But that is better than suffering from cancer of the breast. Okay? So now, second, cancer of the cervix. I know that you are very familiar with cancer of the cervix, cancer of the cervix. But do you know that cancer of the cervix is preventable? Do you know? Do you know that cancer of the cervix is preventable? Nobody should die because of cancer of the cervix. Nobody. In Kenya this time, it is the highest number, is the highest growing cancer in Kenya. But your government has really put a lot of measures in such a way that you will be saved from cancer of the cervix. But I realized that most of the women don't go for that particular procedure. First of all, cancer cervix, we know where the cervix is.
Yes,
okay?
yes.
The cervix is the mouth of your uterus. And it is the organ that we say when you are in labor. We say, oh, you're already 10 centimeter, 5, 6, 7, 8, 9, 10 centimeter, the baby is coming out. Okay? That is your cervix. It is a very small organ, round, very pinkish, very smooth, like the face of a newborn baby. Okay? And that cervix needs to be maintained as it is. Very round, very pink, very smooth, like the face of a newborn baby. Later, I'm going to tell you how do you maintain your cervix, okay? When it is inside. Okay, now, although this is a very small organ, but this one also can make your life you suffer because of this cervix, even though it is very small and it is inside. Okay, now there are two types of this cancer of the cervix. As I have said, I don't want to give you like squamous epithelium carcinoma, like this. Okay, there are two types there, depending on the cells that are where the cells are situated. Okay, if this is your cervix, this cervix is divided into two. And there is a separator in between called transformation zone. Okay? Now there are cells that are located outside and there are cells that are located inside. These cells should not be interchanged. By the time we will see in the examination that these cells here are already found here and these cells here are already found inside here and that one is already cancer. Okay? So, that our cervix must be intact. That's why I always tell the women, how do you make your cervix to be always a normal cervix? How? Women should always come to a gynecologist, not necessarily to me. A gynecologist once a year, irregardless of whether you are feeling pains or not, whether you are having pains or not. And for those who have already started the sexual experience, the first 3 years of your sexual experience, you must have already started your pap smear. What is pap smear? It is a short name for Papa Nicolau smear, but it is commonly called pap smear. So who among you here have done pap smears? Okay? Oh, quite a lot of you also. So, pap smear is a painless procedure, 2-minute procedure in the office of a gynecologist, but this will save your life. Every year, you are supposed to come for regular gyno checkup, okay? Whether you feel pain, whether you experience something or not, you really have to come. Reason. This cervix of ours, although it is inside, okay? If it is not seen, who would know what is happening inside? Who? If you will not come for regular checkup, how do you know that you have problem with your cervix? And for those who have sexual intercourse, because we are all married, okay? Those who have every time you have sexual intercourse, okay? Over the years, if you don't come for regular checkup, 3 years, 4 years, 5 years later on, now you feel pain on the back. Then you always say that, because I have so many work at home, I go to the shamba, I do this one, this one, that's why I have back pains, okay? Not knowing that that is already the start of your cervical problem, okay? I would like to let you know that the first stage 1 of your cancer of the cervix, you will not feel anything, not even pain. There's none. Later on, you will notice that there's a discharge, something like yellow, and then sometimes it's accompanied by blood stream, something like that. Okay? Then that one will not bring you to the doctor. Those signs and symptoms, it will not bring you to still convince you to go to the doctor. Later on, every sexual intercourse, there's blood that comes out. After sexual intercourse, there's blood. I think this time will really convince you to go to the doctor now. Then after that, the last, signs and symptoms is that you will have pains. But the pains is already last, and it can be already an advanced stage of cancer. So, remember that the first stage, you will not feel anything. What procedure will diagnose your cancer early? Pap smear. But before pap smear, Kenya has devised a way that the women, all women must go for cervical cancer screening. And this is the procedure that I'm saying that not everybody is availing this procedure. It is free. I think you only have to pay 100 or 200, something like that in a dispensary. But normally it is free, and it can really save your life. From there, from the nurses who does the cervical cancer screening, they have the procedure. Once they see an abnormality, they will refer to a gynecologist. Now in the gynecologist, we examine, and then we see that really there is really a problem. So we do pap smear. Pap smear is more detailed than cervical cancer screening. But cervical cancer screening is the first step to saving your life. So please, if you haven't done that, go to your dispensaries and do your cervical cancer screening. Okay, now after the pap smear result will come, pap smear maybe will say that, oh, it is L seal or H seal. It's a result of the pap smear. So if it is L seal, we say, okay, we will treat you. Then you come back after 3 months, we repeat the pap smear like this. But if it is H seal, we recommend that we will do a procedure whereby we remove the portion of your cervix like this, including that separator, the transformation zone. Okay? We remove that one for 2 reasons. One, it can be a treatment to that cervix, and in 6 weeks' time, your cervix will come back to normal. Then we will repeat the process until it becomes normal. Second reason is that it diagnoses your cervix, because the portion that we remove, we send it for biopsy. And the biopsy will tell us whether your cervix is still normal or becoming abnormal or getting cancer of the cervix. So from there, we will know what to do next. For example, if it is getting cancer of the cervix, we advise you that we remove your uterus and your cervix, and you will be free from cancer of the cervix. Okay? Yeah. But stage 2B, up to 3 and 4, that one we cannot. We refer you to the oncologist for further treatment now. Okay. You might say, what is the cause of this cancer of the cervix? As I have said, all cancers have no cause. It's unknown, okay? But in this particular cancer of the cervix, there is a virus called human papilloma virus, HPV, okay? That is the most common cause of cancer of the cervix, HPV. That is why we need to do 2 things also aside from pap smear. One is vaccination, cancer of the cervix. But vaccination are only for those 9 years old to 16 years old who have not started sexual experience. Okay, who have not started sexual experience. They can be given a vaccine. How do we know? Because in our setting, even a 15-year-old can have already sexual intercourse. Okay, I can see from where I am. If I have like a patient, for example, like 13 years old, and what is your problem? Problem is I have discharge. How did you get that discharge when you are still 13 years old? So we examine. That 13 years old, do you think that the vagina can accept so many fingers? Yeah? Normally at 13 years old, even this one cannot enter. Okay? In my fingers, this one cannot enter. But this type of girls, okay? Even this one has a very small entry. So I usually encourage them. Okay, you know what? Because first they will deny. Have you already experienced sexual intercourse? Then they will say that no. So, but anyway, you will know from your examination that they have. Okay, so you will start to give them all the counseling and this and all those things. Okay, So vaccination, and those single adults can also be given vaccination, but they need to get an HPV test, human papilloma virus test. If they are negative, they can be given vaccination. But if they are positive, they cannot be given vaccination. Remember, human papilloma virus test is 10,000 plus. That is the test for that. Okay? So now that is the most common, that is the virus that is the most common cause of cancer of the cervix. What are the contributing factors? Very fragile, okay? And sexual intercourse, the penetration in and out of the vagina, that one will erode all the walls of the vagina. And that is how cancer can affect them in the later life. So teach them, tell them that this one is very important. Number 2, multiple partners. If you are very lucky enough to marry a very handsome man, you will have a problem. Sorry, you will have a problem because this man, being very handsome, will go to 1, 2, 3, 4, 5 women, then come back to you. And no matter how you remain very faithful wife, okay? Because of this problem, coming back to you, they will give you all those kinds of problems. So, multiple sex partners. So, please, young generations, please put it in your mind that these multiple partners will not give you any good at all. Even if they will give you so much money, but in the end, you will really ruin your life. Okay? So, be faithful to one husband. Then, do not go for sexual intercourse before you get married. So, remember that your virginity is the best gift, okay? Losing weight. Maintain your weight to your normal BMI, okay? Body mass index. So that, first of all, it will reduce your chance or the risk of getting cancer. Not only cancer of the cervix, but also cancer of the breast, any kind of cancer. So maintain that, as what Ellen White has counseled us always, that we are to eat fruits, grains, vegetables, water, enough water, okay? All those things we need to put in our mind. We should not take a lot of mafuta, or this oil, yeah? Regardless of what kind of mafuta, it's still mafuta. It will still come back and accumulate in our veins. Okay, and the salt, you have to reduce your salt. If I'll tell you now, you will not believe me. That means my 2 liters of oil, I can use that for 10 months. 2 liters of oil. That's why during the time when Kenya had a problem with oil, me, I didn't have a problem with that. And because I remember you have very nice green leafy vegetables here. Very nice. So what I do is I boil water and then I clean the green leafy vegetables, any kind. Okay, then when it's boiling, then I place that one, boil for 2 minutes, I remove, that's what we eat. Without salt and without oil. Okay? If you really need to saute your onions and your tomatoes like this to mix with sukumawiki, whatever, something like that, you mix it with water. You saute it with water. It will really give you a healthier life, okay? Remember that fats can really accumulate in your blood vessels going to the heart, and that is the start of your problem, okay? So those sort of things, okay? And then HIV, cigarette smoking. I hope that there is nobody here who smokes cigarette. Cigarette smoking also is one of the factors, contributing factors towards the development of cancer of the cervix. If you ask me, what do we do, Daktari, when we have cancer of the cervix? If we find you in our clinic, for example, you know, the smell of that discharge is very prominent and characteristic of cancer of the cervix. That means, if there are patients who are lined up there for me, and then I pass by that line, then I know that I have patient who is cancer of the cervix. Then I always tell the nurse that go see, because there is a patient who is cancer of the cervix in that line. It's very characteristic smell. So if we find you in that stage, and then we do all those procedures that I've said, and then, for example, if you are found that stage 1, for example, immediately we do all those procedures for you to be free from cancer of the cervix, okay? But the most important one is early diagnosis. So go for cervical cancer screening and also pap smear, so that we will be able to diagnose you early. What are the foods that they say will help you to prevent cancer, the cervix, and improve your body well-being. The Loma Linda University, those of you who are acquainted with Loma Linda University, well, it's an Adventist institution in the United States. They always do a lot of research. So they have researched that soya beans, you know, you people, you feed it to the cows and the what like that, okay? But it is very good in reducing the signs and symptoms of menopause, as well as making your body strong. So all kinds of soya products, soya coffee, soya chocolate, soya meals, soya, what is this, milk. Yeah, so you can take that one, but not so much also for you to get arthritis, because being beans, it has a lot of purine and it can cause also arthritis in the bones. But if you are always regularly exercising, you will not be able to get that arthritis if you are always exercising. So do that, because and our age, like for me, for example, those who are in my age, they already have pains in the knees here and they could not walk. Okay, so exercise is the best way. Okay, so any question?
Only soy.
Family planning a risk factor? I said no. Okay? But this is the clue. When you choose a family planning, or before you choose a family planning, normally you are done pap smear. Pap smear so that we will have a baseline of your cervix. Then, if you choose, for example, then the clinician will ask you to choose this one are these advantages of this family planning method. This IUCD is the advantages and disadvantages. This one condom, advantages and disadvantages. Pills, this one advantage. Then you choose, okay? So now when you start, for example, just coil, IUCD. When you choose the IUCD and we insert the IUCD to you, the normal protocol in the review of the IUCD is like this. Once you are inserted after a normal pap smear, you have to go back to the clinician once every month for 3 months, for the first 3 months. The reason is that these 3 months will allow your body to adjust to the foreign body inside the uterus. You remember that for those of you who have been using IUCD, sometimes you have heavy menstrual period, okay? And also pains. Those 3 months, the first 3 months are the transition period for your body to adjust to that. If that in the 3 months you cannot adjust, there are so many signs and symptoms that you experience, we remove. Okay? Then after the 3 months, if you are okay, then the next checkup will be once every 3 months. But most of you do not come for once every 3 months checkup, my dear. I know that not even once every year. There are patients who come to me, Doctor, now I cannot feel my IUCD, the thread, no? So when you examine now, the IUCD is already up into the uterus, has already pierced through the uterus. So when was the last checkup that you had, that you went? No, I think Tatari, since it was inserted way back in 2014, I have never gone for checkup. So that one now is what will give you the problem. But most of us, we do not. We do not come for regular checkup. Once every 3 months, I am okay. I will not just go. So that is now the problem. Okay, another question? Yes, ma'am. Okay, reduce. It is not giving us a lot of. We are not going young. We are going forward. Okay, as the age advances, the bones and the body organs deteriorates. So at least we have, like there is always a saying that as this age of ours, like for me, for example, 66 years old. So you eat like a poor man. You do not have the luxury of eating the things that we used to eat. It's an irony, because when we were still young, we do not have money also to buy all these things. We always envy our rich classmates maybe that, oh, this one we cannot afford. Now that we have work, we can afford. The doctor will tell you, oh, don't eat this one, you cannot eat, this one, you cannot eat, this one, you cannot eat. But as Adventists, we know that what is the best and the healthiest lifestyle that we have. We are being taught that one, and we are very privileged to have that information. So let us follow that information, because that is the best. Even this time, the last gynecological conference of all gynecologists around the world, it was in Brazil. They said that the Adventists have 10 years longer lives than the ordinary. Why? The research says that it is because of our lifestyle. Yeah. So we are very privileged, really. Younger generation, you are still young. Okay? There will come a time when you will be old also. So don't wait for the time when you will suffer from all those other problems that we are suffering this time. Go implement what Ellen White has been teaching us, had been advising us regarding lifestyle. By the way, 40 and above women, don't eat too much in the evening. Okay? Because if you eat too much in the evening where you do not work in the evening, you only sleep and pull your blanket. If you eat a lot in the evening, you will accumulate all the nutrients in the body and it cannot be used. So most of us will develop big tummy here because of that. So don't eat too much, but eat a lot in the morning. You know, reverse yourself. I know your culture. And in the morning that we eat only because we are so much, we run. So one chai, one pot of chai, and one slice of bread, that's all. We go run, okay? It's not enough. Eat well, balanced diet in the morning. Then, at lunchtime, maybe you eat or not, that depends on you, but for me, I eat a lot in the morning, then the next meal for me is a very... So in the evening, maybe, you can just drink 1 glass of milk, or eat fruits that you have, or make your own fruit juice. Do not buy the fruit juice from the market, that one is not healthy. So make your own fruit juice, okay? So that is a lifestyle change. Lifestyle change can also help us. We change our lifestyle according to what we are being taught by Ellen White. So, any other question? Please, ma'am.
What causes itching in the private part and even in the...
Itching in the private one. Yeah, it's very common, yeah? Don't be ashamed that it comes on and off, on and off, on and off. If you have diabetes, for example, or family history of diabetes, there is a very high chance that you will get always persistent itchiness of the vagina, because it is one of the signs and symptoms of diabetes. So if you have diabetes or family history of diabetes, you will always get that on and off candidiasis, vaginal candidiasis. Or if you always take antibiotics, there are antibiotics which causes itchiness of the vagina. So as much as possible, especially for those antibiotics which are not completed. I mean completed, you know, there are always prescribed regimen and antibiotics. For example, like if I will give you Augmentin, for example, you need to finish at least 10 tablets twice a day for 10 days, okay? Even if you feel second day or third day, you already feel good. You have to continue because you will develop change that you will not respond anymore to antibiotics. So don't misuse and abuse the use of antibiotics. That one also can have pain. Treatment, okay. Treatment that will depend on the kind of bacteria or fungus that you have in your vagina. To tell you that you don't need to wash the inside of the vagina. Wash only the outside of the vagina. And it is supposed to be twice a day. One in the morning and one in the evening, but don't wash the inside. The reason, our vagina has its own bacteria inside, okay? Normal in that vagina, which protect our vagina from outside infection coming inside. We call it normal flora. Okay? The normal bacteria which is inside. Now if you wash that inside, the vagina canal, you will wash also the normal flora. So nothing will prevent you from infection coming into your vagina. Okay, another thing is that, Mama, another thing is that we have 3 holes in our here, private part, okay? This one is for the anus, this one is for the vagina, and this is for the urine, okay? They have different holes. They are not the same. Each hole has its own bacteria, the one that I said normal flora, okay? Which guards each hole from outside infection coming inside. Now, for us women, when we long call or short call, we always use tissue paper. Who use other means to clean your anus and your vagina? Tissue paper, okay? Tissue paper is either you will start here, going up, or up, going down. What will happen is that you will bring the bacteria from here to the other holes, okay? You get that? When that hole, for example, if the bacteria from the anus stays in the vaginal area, and then you will have sexual intercourse, that sperm will bring that bacteria up into your uterus. Because what is the role of the sperm? The sperm will go up and swim into the uterus, up to the fallopian tubes to meet the egg. Yeah. So those, those bacteria will be carried over because they will ride at the back of the sperm. We call it piggyback. So that is how you get infection. We call it ascending infection in women from time to time. If you do not come for regular check-up, what will happen? It will damage your cervix, it will damage your uterus, it will damage your fallopian tubes. And that is how we get blocked tubes, that you are not able to get pregnancy. Ovaries, there are 2 ovaries, right and left, okay? These ovaries are the organs which produce the hormones in the body. You know, we have hormones in our body, especially for the women. We have 5 major hormones in the body: estrogen, progesterone, LH, FSH, and prolactin. Those are the 5 major hormones in the body. And it is being produced by especially estrogen and progesterone, produced by these ovaries. Now, when these hormones in the later life, like 40 years old, when you're approaching menopause, or 50, something like that, your hormones become imbalanced. One is shooting up, estrogen, the other one is going down. That's why we call it a hormonal imbalance, okay? Now, this ovary will respond to the fluctuation of the levels of hormones in the body. That one. So, when it is high, it also enlarges a little bit. For as long as your enlargement of your ovary is less than 5 centimeters in diameter, it is not for surgery. Okay? We call it physiologic cyst of the ovary, meaning to say it's just responding to the physiologic imbalance of hormones in the body. Once the hormones are balanced, this one also will regress in size. Remember, when it is less than 5 centimeters in diameter, it is just called physiologic cyst of the ovary, and it is not for surgery. Okay?
What is that? Explain to us.
Yes, I explain. Endometrium. First, I will give you the brief explanation about the endometrium. This is our uterus, okay? The muscle of the uterus, the muscle inside, is called endometrium. And this endometrium, the characteristic of the muscles of the uterus, it contracts, okay? To expel the blood out during menstrual period or expel the baby out during delivery. This uterus of ours, okay, will keep on contracting. That is endometrium, and that is the characteristic of the endometrium. Now, this endometrium is located only inside the uterus. It can never be outside any other. It's always inside the uterus. But there is a disease in women called endometriosis, whereby the endometrium, instead of only inside the uterus, now comes out of the uterus, migrated outside of the uterus, and lodged in either the back of the uterus here, we call posterior cul-de-sac, or in the ovaries. when the endometriosis affects the ovaries will develop a chocolate cyst with chocolate-like fluid in it. That is how it is called endometriosis. And this endometriosis is so painful, especially during periods. The reason is that if this is your uterus and the endometriosis are here, okay? Now, this endometriosis here, it still has the characteristic to contract, even when it is also already outside. So that's how you will feel pains during menstrual period. That is endometriosis. And it has mild, moderate, and severe diagnosis. Okay, some more? Cervical cancer screening. If in the cervical cancer screening there was a report that your cervix is no longer normal, it has some leukoplakia or white plaques in it, then you will be referred to a gynecologist. The gynecologist performs the pap smear. Okay, then we send it to the cytologist to read. When the report comes and the report has H seal or L seal or CIN 1, 2, and 3, okay? Now it depends on that. Maybe mama, that one, the result was CIN 3. That is why it was referred for another
Test.
biopsy. We need to have a biopsy. Biopsy is what I told you, that we have to remove a little bit of this cervix and send again for biopsy. We call that. This one is the biopsy now. Or another biopsy is cervical pans biopsy, but we get like 3 parts of that one, small tissues, and it's sent for biopsy. But the best thing is really to get that one and then send for biopsy. I think that is why there was an abnormal report in the pap smear that will lead the doctor to go and do the biopsy in order to further diagnose the problem. Was reported. For example, after long call, after you pass stool, okay? If you just wipe it with tissue paper, the stool will still be remaining here, in this area. We call it anal sphincter. Whereas if you wash it with water, you wash including that anal sphincter. Then after that, you just wipe it with your tissue paper. Bananas like this, it can make your stool very high. So if you really want these bananas, you drink a lot of water so that you will not have problems with your stool.